we have, for several different types of cancers, have discovered the mechanisms of resistance. So we're trying to figure out ways around those mechanisms of resistance. A good example of this, for instance, is the estrogen receptor, where when someone becomes resistant to an aromatase inhibitor, we know that mTOR is sort of a final common pathway. So we now have mTOR inhibitors, such as everolimus, that allow us to overcome mechanisms of resistance. And we're seeing that for different segments of the breast cancer pie, where we can now identify mechanisms of resistance and overcome it in many cases. That way forward seems pretty straightforward to me. That's just a matter of applying, in many cases, what we already know to the cancer puzzle. And I think a lot of that is going to fall out over the next few years. I think the long-term issues are going to be different ones, and the ones that interest me in terms of where we need to go, the ones that excite me, I would say are in kind of two broad areas. One is that we still have not been good at tackling the problem of estrogen receptor positive cancers that come back down the road. The problem of tumor dormancy, where a cancer will sit there for 5, 10, 15 years and then will relapse. How do we identify which are the dangerous cancers that are going to relapse down the road? And how do we treat those cancers that obviously have been sitting there doing nothing for years before they suddenly take off? So that's one, I think, really exciting and important area of research going forward, the area of tumor dormancy. It's one that we've been working at in my laboratory. The other area, obviously, are the highly aggressive cancers, such as the triple-negative or basal cancers, again, where this genomic chaos rules. If, as I've suggested, the kinase treatments represent sort of a box that we need to get out of in these smart cancers, how are we going to approach these cancers? What non-kinase-based approaches are we going to be able to apply to these cancers? And I think that's another exciting area of research of which lots of people are working on, and I hope that we're going to have some good answers in the near future.